Hello and welcome everybody today to the INFORAFRICA panel. My name is Sarah Fitzgerald. I'm a consultant based in London working with Aequitas, a communications consultancy. Today we're going to be discussing how health responses across sub-Saharan Africa can and are adapting to the spread of COVID-19 and how to support communities and those most at risk. And to share their insights, we have a panel of wonderful development and health experts working for charities in Zimbabwe, Namibia, and Zambia. They're all part of a brilliant network of development organizations called Development Aid People to People, associated with Humana People to People. This panel is part of the INFORAFRICA Alliance. This alliance has been set up to respond to the challenges faced by Africa in tackling the pandemic. And at its heart is to share accurate information which can save lives and keep people protected. So to introduce my panel and hand it over to the experts, we have joining us from Zimbabwe, we have Ruth Makumbe, a health project coordinator, and Luckson Soda, Chief Liaison Officer. From Namibia, we have Alfred Besa, National Project Coordinator. And from Zambia, we have Mwansa Fredrick Katunga, Director of Programs. I think it would be a good way for us to start would be to give everybody the opportunity to introduce yourselves and to tell us a little bit more about your work. And to start that, could we have from Zimbabwe, from Ruth and Luckson?
Yes, hello everyone. My name is Ruth Makumbe. I'm the programs coordinator for DAPP Zimbabwe. I work in the production department, which is responsible for project programming. And our main responsibility is to support the projects which are working directly with the community, and we are there to make sure that they succeed in their production. Currently, we are implementing 16 projects, which are also based in the rural areas, and they are focusing on 4 main areas. That is, we are into health programs, we are into agricultural programs, and we are into community development programs, and we are into education programs. And our main focus is to ensure that we empower the people in the communities with the knowledge and skills to improve their well-being.
Fantastic. And Luckson, can you introduce yourself and just tell us a little bit more about you to start?
Hello, everyone. My name is Luckson Soda. I'm the Chief Liaison Officer for Development Aid from People to People in Zimbabwe. I've been working with DAPP for the past 25 years. I like this type of work, working with the people and see their life improving. Development Aid from People to People Zimbabwe has been working in Zimbabwe for the past 40 years. It is a 40 years of improving the livelihood of people together with the government of Zimbabwe. As DAPP, we are reaching annually 300,000 people with our programs, as alluded by Ruth, that the 4 thematic areas with the health, with also training, we also reach the farmers with the Farmers Club programs to improve their nutrition and food security. We are working in 5 of the 10 provinces in Zimbabwe. We have been also very instrumental in working with the emergency. Sometimes Zimbabwe has been hard hit with Cyclone Idai, and we have been so active and instrumental to support the people affected by the cyclone. And now we are also very active working with the COVID-19 as the pandemic affecting the whole world.
Fantastic. Thank you both very much. And Mwansa, could you introduce yourself and tell us a little bit more about your work?
Hi, everybody. My name is Mwansa Fredrick Katunga, and I'm from Zambia. I work with development aid from people to people as a director of programs and based at the headquarters. I've been working in development aid from people to people for the past 22 years, and also to other Humana people-to-people associations in other countries. And we have been helping many people in fighting diseases, poverty, and capacity building so that they can have skills to improve their livelihood. Development Aid from People to People is a non-government organization that has been in existence for over 30 years in Zambia. And we are reaching to about 1.3 million people in the 10 provinces that we have in the country, of the 17 million people. Development aid from people to people in Zambia, we are working with education, agriculture, community development and environment, human rights in correction facilities, formerly known prisons. We also have Clothes and Shoes, which is our fundraising business, and also in health. We have been instrumental in many activities in the country, and especially in health. Right now, our focus is working to contribute in stopping HIV and AIDS pandemic and to support those that are infected and affected of the diseases. Fighting the new pandemic also of the COVID-19 is something that we have been part of since the start of this. So we are working in 655 health facilities situated in the 5 provinces of Zambia related to health matters. And that's the major focus at the now.
Fantastic. Thank you so much for that introduction. And now, Alfred, could you tell us a little bit more about yourself and your organization?
Thank you very much. Hello, viewers. My name is Alfred Besa. I'm working here in Namibia with Development Aid from People to People, which is a non-governmental organization which started its activities immediately after the independence of Namibia, that is in the 1990s. We are running various projects which stem from health, education, and community development and climate change activities. And one of our biggest major activities which we are involved in as DAPP here in Namibia is the implementation of an HIV/AIDS activities, which is called the TCE, the Total Control of the Epidemic, where we have field officers who are going in the community doing HIV testing, linking people, those who test HIV positive to the treatment so that they get the treatment, and ensure that they establish some community adherence clubs to help to stick to their medication. And as an organization, we are proud to be part of Namibia, which is a country which is with a population of 2.5 million people. You can say maybe it's relatively smaller compared to other countries, but it's on the verge of reaching its target when it comes to the stopping of HIV. The targets that have been put across by the UNAIDS, which is the 95-95. We have seen tremendous effort that has been put in place. Both, you can say it goes from the commitment from the government, but also due to the development partners like the DAPP, who has ensured that there are field soldiers who are working together with the people. And we believe that it's the people who have the power to stop the spread of HIV. And when it comes to COVID, you can also see that we can use some of the experience that we have had over the last 15 years in the fighting the epidemic, but what we have learned so far. Thank you.
Incredible. You all are doing incredible work, and it sounds like the impact of it is felt already, and hopefully will continue to be felt. Ruth and Luckson, I was wondering if you could tell me more about how COVID-19 has impacted your work in the development sector, or specifically in the health sector.
Yes, we are into development work, and we are working with the communities in the rural areas. What we do is that we use different approaches in how to reach the people in the community. For example, we look at group gatherings, where when we are giving information, we can also have some group gatherings where we give information on HIV and AIDS, on TB, and on cancer. And then sometimes also we have these group trainings, for example, in Farmers Club, where we also train the farmers on the new methods of farming. And also we are doing this door-to-door visits, for example, in TCTB, where we are also giving information to every individual whom we meet in the community. But now, due to COVID-19, we are not allowed to do these group gatherings. And when you look at 2020, when we planned for 2020, we didn't know that we are going to have this kind of disease by now. And we have planned with our goals and all our activities in January 2020. But then with this disease now, with this COVID-19, we can see that we are no longer going to achieve our goals as planned. Then again, I want to say this COVID has also affected our economy as an organization, because as a result, we ended up cutting our budgets. And then what does that mean to our activities again? Then our activities again, they've been also reduced. So it has also affected our activities on the ground. Then when we look at also our work as the production office, we are there also to do monitoring and evaluation in the field. We have to visit our projects and make sure that we meet the people in the community. We hear from the beneficiaries if they are also benefiting from our programs. And also we have to support our projects on the day-to-day running of their programs. But now when you look, because of this lockdown, because of this COVID-19, then we couldn't, for example, from this quarter, this second quarter, we couldn't manage to visit the fields to go and support our projects. So again, in that area, we have also been affected. Yeah, that's what I can say.
Yeah, I think I can also say that this is a new normal, meaning that despite all these challenges we are facing in our programs, we have also started to come up with a lot of initiatives that we can at least continue to reach some goals or reach the people. For example, we have a training for the youth, which we got funding from EU to support those vulnerable youth, at least to get some skills that they could also employ themselves, because unemployment is so huge in Zimbabwe. But because the schools are closed, and then we say, let's look at how we can continue to support them. So we introduced the e-learning, where they could, the instructors could send some tasks to the students. They respond, and we're using the Skype, the emails. It's another way, because we have said we have to do something about it. So innovation, and this is how we are continuing to reach some of our programs through distant. And I think this is very good, and we'll continue to do that.
Thank you. Yeah, technology has really proven to be such an important and powerful tool at the moment. Alfred and Mwansa, you both mentioned your work in HIV and AIDS projects and a project called Total Control of the Epidemic. Could you tell me more about how this work has been impacted? Mwansa, maybe we'll start with you.
Thank you. DAPP in Zambia, like I mentioned, that we've been working for over 30 years. And these 30 years of experiences in mobilizing people, our long-term slogan to fight the HIV epidemic has been, and is still, only the people can liberate themselves from the epidemic HIV. And this is also our slogan in the time of COVID-19. Every person has to know the facts and take action. And this means that we must get the messages to every person for them to be able to take informed choices, keeping distance, wearing masks, avoid necessary travels, etc. And what we can say during this period is that we acted quickly to train our staff and incorporated the COVID-19 messages into their work, that all the people reached in our projects are getting the preventive or prevention messages. We are telling the communities to stand together and to assist those who are in need of help. We have continued to work in all our projects. Luckily, in Zambia, we did not have a lockdown like in many other countries, which is very good that our government actually acted very quickly in taking actions and bringing the international and national civil societies together, which has really been a response that was a positive, and all of us aiming at supporting what the Republic government of Zambia was trying to do. And therefore, much of the support, again, we can see that all our communities and our work actually has continued, because we did not want actually to close out and think of stopping the other work which we have, which is a plus, and we actually appreciate the government effort and all the civil societies that were involved into that. So our soldiers that are on the ground in our work, where we are reaching the 655 health facilities, have been equipped with the information that on a daily basis they're taking to the people. We have all the target groups that we are meeting in testing HIV and AIDS. We have certain groups like the teen clubs. The teen clubs, HIV positive children, who are actually meeting in smaller groups at the health facility. And the meetings are facilitated by the health in charge, where they are taught about different methods, how to live healthy, how to take the drugs. And through that, again, we can see that the messages of COVID-19 have been passed to these children, who are able to pass on the messages strongly to their families in their homes. So this, actually, we can see that we are lucky in the sense, and we just appreciate that. We had 2 or so instances in Zambia where we had 2 towns where there was the EPIC center, and then what happened is that the government immediately took action to close down one town, that Kafiwe, which is in the southern part of Lusaka. And then they had to take action where everybody in that community, in that town, was told not to move out. And then there was a quick action of cleaning up, and started testing the people and stopping all the people that we are trying to move out of town or coming into town, which was very, very good. And we also see the same action taken in another town, which is the border to Tanzania and Zambia, Nakonde, where a very quick action again from the government, and the community also responded positively. I think this is also what we can see, that being in the community, we have not let down to continue doing our work. And we actually continue to say, it's only the people themselves that can take action. That slogan works very much. And we can see that as TCE, the method that is being used in COVID-19 of this contact tracing is actually the same that the government has taken from the index contact, which is something that we've been incorporated in our TCE program for like 2 years ago now. And that experience is very good to use, because it targets every single person that was in contact with another one. So this is how we are doing, and we think that it's going so well.
That's fantastic. Thank you so much. And Alfred, you also mentioned the HIV and AIDS program and the 1995 goals. Can you tell us a little bit more about how your work has been impacted?
Yeah, you can say for Namibia as a country, immediately when there was the first case of COVID was identified, the government took strict measures and put down some regulations that involved locking down the whole country for in this following month. And this meant that many activities, our work, which involves going from one house to the other, was actually limited. But what was important during this regulation is that the government asked organizations that they have to come forward and argue their case if the work that they are doing is essential so that it can continue to operate. So we saw a situation where half of our field officers, those who are actually working with at the health facilities, were actually allowed to operate. That means we were able to continue to work normally. But the field officers who were mainly going from house to house, we had to put them on hold due to the fact that we wanted to respect the regulation that was in place. And we also were encouraged that we need to follow what the ministry is saying. But I think what came out as part of the work was that we were also able to assist the government, because during the lockdown, the government also realized that many people who are on treatment who have challenged to go and pick up their medication at the health facility. So the government came with a policy or an initiative that people who are on medication should be allowed to have enough medication so that they don't go to the health facility. And we were part and parcel of assisting. That means to identify those who are HIV positive and who are on treatment and mobilize them so that they are able to get the medication for 6 months. And that meant that they would not be able to go to the facility for the next 6 months. And what this means is that they decongest the health facility, and potentially also when you travel in the public transport, you risk the dangers of getting infected to COVID. So we appreciate that effort, because it was about preserving life, and we have to abide by the regulations. And we can also see that the action that was taken in place by the government also meant that Namibia recorded the fewer cases of COVID-19, and which mainly were imported cases. There has never been, you can say, community cases that took place. And one of the reasons you can say was the swift action. And then we also have to make sure that we protect our staff, and that means that we have to set aside some funds and make sure that they have their personal protection equipment, and they have enough hand sanitizers, which was not within our budget, but that was necessary also to promote the work and the effort that the government wanted to see, that the COVID does not spread to a smaller population like here in Namibia.
Fantastic. It's really, really hopeful that all your work has been able to continue and also to adapt to respond to COVID-19. A big part of the INFORAFRICA Alliance and the INFORAFRICA Festival is focused on sharing accurate information. And some of you have touched on this already, especially with the HIV and AIDS response, that only the people can help themselves from the epidemic. Is there any specific advice or learnings from health projects that can be applied to COVID-19 response, or as a will of hope, or advice for what people should be carrying out right now? Luckson, do you want to start? Is there any advice or learnings you can share?
Yes, I think some of our lessons we have learned and the advice we'll also give is this, that when you are working with health programs, which is exactly what the COVID-19 demands us to focus on, how do we include everybody? And that means that I'm talking about inclusivity of everybody to take control, because this is an epidemic, and it means that anybody is in danger to be affected. So information has to be precise. Information has to be very correct. Like when the COVID-19 started, there was a lot of misconception and rumors and through social media. So people could have a lot of confusion of what to do. But the advice I can also continue to give is information has to be very correct. I think in this COVID-19 fight, it is clear that we have these guidelines from WHO with all the advice together with the Ministry of Health, which we came up with some posters and flyers that the community would be reached with the correct and precise information about how they protect and prevent and fight the COVID-19.
Fantastic, thank you so much. Ruth, did you want to add anything, or did Luckson kind of cover it from your guys' side?
Yes, I can just add to say, I think also what we have learned from our previous, for example, TC program, is this of involving everybody and also using, like, for example, our field officers, reaching to each and every person with the information. I can say right now, here in Zimbabwe, our field officers, they've been trained on COVID-19 by Ministry of Health. And what we've learned also is that they are together with the people. They are part of the community. And the people, they believe in our field officers. They trust in them. And they also, there is also build a good relationship with the community. So you can say that when now our field officers are doing door-to-door, giving information on the COVID-19, you can really feel that, yes, it's going on well because the community, they have that trust in our field officers when it comes to giving correct information to the community.
Yeah.
You know, there are already structures in the community. Every community has got a structure. So one of the advice is that then those structures are permanent structures in the village, in towns. So using those structures as vehicles of information, as vehicles of reaching everybody, I think it's a very, very important, because then the people are used to their structures. So those structures are very important, like the village health workers, the volunteers in the community. So using already existing structures are a very important fact.
Yeah, definitely. And a community that responds where trust and accurate information is at the core is so important. Alfred, did you have any learnings or lessons, advice that you can share?
Yes. I mean, one thing when you deal with this type of pandemic, the most important thing is also the science and the facts. So what is it that we know? I think it's important. I think our experience, 15 years, 20 years experience in the HIV field tells you also that there's been a lot of misunderstanding of how is it transmitted, how can you protect yourselves. But it's important that the messaging is clear and that the people are mobilized. That's important. So here, I think the advice is that we have to follow what WHO is saying, what the Ministry of Health, our local Ministry of Health, telling us to do, what information is available. We have to use that. An example is in Namibia is that we are very fortunate and happy that we can see a country where also the government has set up what they call the COVID-19 Communication Center, which is responsible or mandated to actually provide accurate information to the public and ensure that every sector is not left alone. And it's providing daily briefing so you can see where we stand, what should happen, and everyone is well informed. Because if with the right information, everyone getting access to the information, there's a lot of, in the modern world, we have a lot of social media, we have different things. So we have to be very careful, but then that means we have to be proactive in making sure that the correct information is available to the people. And once the people, they have the right information, they have got the power to act on the information that they have received. And this is a tool that we have also seen that once the people are empowered with the correct information, they have a tool to protect themselves, they have got a tool to take actions, and they have the tool to defend the country. That's my advice.
Yeah, absolutely. Information is power. Mwansa, do you have any advice and learnings to share from your experience?
Oh yes, I think I'll start from the experiences we've got from the, you know, we are, DAPP in Zambia is connected to Humana People to People Association Federation. Through these years, we have learned from how to tackle issues of HIV and AIDS. In 1996, we started a smaller project actually in Zambia, which was called HOPE, that was giving hope to people that were HIV positive. And we started from there trying to teach people, testing them and how to live healthy, about nutrition and so forth. But later on, we realized that HIV epidemic actually is not going to be over soon. So there was an aggressive approach to how do we tackle HIV and AIDS. And that led to the design of the total control of the epidemic, the TCE program. That was basically targeting in many angles on individual basis, that every single individual takes, they have to know the facts, like Alfred has mentioned and my colleagues have mentioned, and they have to know the truth about it so that we dispel all the misconceptions. And then from there, the people, they're able to take action, their own action in the decision. And then after doing the taking those actions, then they'll leave to say, okay, if they're found to be HIV positive, they can be put on treatment and then they can live health for many years actually, which we've seen that working. So coming to what we have seen during this COVID-19, the response and also this cooperation that, first of all the international and national and civil societies together with the community has been very great. That every single person has taken it to say, look, we are the only people that can act and can take this change. And by doing that, we can see that actually the index tracing is proving now to be a better method in reaching out to many contacts. And this method, we see it from the TCE, where we are testing people, putting them on treatment, and following up with the 1995 strategies that until a person gets the immune suppressed. So we can see that through this kind of method of index tracing and contact tracing of every single individual, if we can use it in all different diseases like TB, how to fight malaria, how to fight all any other diseases which we see these are pandemic issues. I'm sure in all our countries, we should be able to reach somewhere that will have control of many of these diseases. So I think for me, I would say the lesson additional to my colleagues is this method of index tracing is proving to be an active element. And I would urge all countries actually to say, let's go for this. And also this of the togetherness that every single person, the organizations, and teaming up with the government institutions to say, let's fight this. I think we can see a better future if we use this kind of method.
Thank you. And I think to touch on what you just said, being hopeful about the future and a sense of togetherness that is being created now, Luckson, I wonder if you could share with us how you feel about the future post-COVID-19 and perhaps positive outlook from some of the innovations that are happening now, such as in the healthcare system or using new technology and ways of adapting.
Absolutely. I can foresee hope in the future. Of course, now we are all busy to fight COVID-19, but whether the question is, are we going to be over this? To me, it's yes, we will definitely conquer COVID-19 by using the technology which is in abundance worldwide, with correct information, with following the protocols from WHO. And I also see that, for example, in Zimbabwe, I think the government of Zimbabwe have taken very aggressive action with the lockdown and locking the borders and restricting traveling. I could also take a leaf of hope also from the action the government and the civil society in Zimbabwe are doing. For example, right now, our cases, our positive cases are still low, 314 today. And for deaths, and the government have tested now more than 50,000. It means that it is possible to control. What we can see is if everybody follow the protocol to prevent and to protect, there is hope that in the near future, we can conquer COVID-19. I think we can also, the knowledge management, we need also to take a leaf of other countries like China and other countries where COVID-19 started. How did they manage to control it? So I think there is very hope of us in Zimbabwe, also in Africa and the entire world to control COVID-19.
Yeah, thank you very much. And Alfred, the same to you.
Yeah, I'm very hopeful about the future post COVID-19. I mean, mankind has always lived through pandemics. If you follow the history, we have gone through as very terrible pandemics, and that we have overcome them. So looking at this one, it's a new thing. It's a learning. It's providing some learning lessons for us. And that means scientists have to work extra hard to find the vaccine, the treatment. But at the end of the day, I know that mankind will survive out of this. And I mean, our experience, if you look for us who have been 20 years, 25 years fighting the epidemic, the picture was very, very, very bad when we started our projects in Africa. It was you see funerals, you see people dying left and right, people without hope. But when we started, but today we are talking of total control of the epidemic, and Namibia is one country which is about to reach epidemic control. And I'm very proud because I have been part of that for the last 20 years, working in the TCE, and where many people did not have hope. So I still believe that people should have hope even post COVID-19. It's a phase. We have to go through this, and we have to invest in the science. We have to work extra hard. And the most important thing is that how should we rebuild the different sectors after we have conquered this? I mean, my colleagues has mentioned something. It's also with each pandemic, some new things comes in, like the e-learning system, which we never thought in Africa would be a thing that should come, but it's now something that even people are considering, working from something that many of us did not believe in, but it's something that came out of this lockdown. But I'm very hopeful, and I think we should all be hopeful. The future should be bright. We'll pass through this.
Thank you very much. The future will be bright. And to you, Mwansa?
Oh yes, I think with I agree with my colleagues what they've said, and I think what we can see also, I'm very hopeful that we go over this. We have many issues in our time of living that mankind is going to continue facing many big issues, and of course these big issues of our time, it's only us that can take part in changing them. So therefore, we have the passion of changing and helping mankind to live in a better world than before. So I should say that we have to continue this fight with the COVID-19. We know the effects are too many, and we have to continue the way that we have started with collaborating each other. And there are so many lessons that we've learned from this. And I think one other thing that we can also see from this is that we need to be, this preparedness. Now, this is a lesson that we have to say, if we had started much earlier, knowing this to say it would be that disaster, and then we would be able to take quick action. But nevertheless, we have learned some lessons that we have to be ready to tackle every kind of disease that comes at any time. So we call upon all ourselves, individuals, civil societies, to join hands together with the government in our nations, and let's continue to do this fight. And of course, we can see that the effect of this are too many also on the poor and unemployment and so forth. The economy, it will take time to review that. But we cannot sit or fold our hands, but we just have to stress that let's do what we can and pass this, just like HIV and any other disease. So yes, the new normal is very good, but we have to continue doing much better. Yeah, that's my contribution.
Thank you so much. And Mwansa, would you say, are you in for Africa?
Yes, I'm in for Africa.
Fantastic. Alfred, are you in for Africa?
Yes, I'm in for Africa.
Ruth, are you in for Africa?
Yes, I'm in for Africa.
And Luckson, are you in for Africa?
Yes, I'm in for Africa.
Thank you so much to all of you for joining the panel today and for your incredible work and messages of hope. I really appreciate it. I'm sure those watching will too.
Thank you.
Thank you.
Thank you.
Thank you.